is amazing to me how many people don't have a primary care physician. That's the doctor you go to when you're sick, but also when you are well, for those screenings that become important as you get older. Today in Get Healthy, we talk with Dr. Matthew Farjan, who explains the importance of a primary care physician and gives us advice on how to choose the right one.
Well, I think it is very important, and I think that there's at least two reasons. The first being that we all need encouragement to maintain our optimal health throughout our lives, especially after, say, age 40. It's particularly important. And the second reason is that navigating the healthcare system, it can be very complex, and we need all the help we can get with that.
And that primary care physician can help you with that.
Yes, I think the primary care physician, more so than the specialists, frankly, are apt to help with the navigating of the healthcare system, making sure that you have preventive care on time, making sure that your health is optimal, and really asking some of the embarrassing questions that have to come up regarding our lifestyle, which may not be optimized. And the primary care physician can be very good at giving the encouragement that's necessary.
Sort of like a life coach in a way.
Yes. Oh, I enjoy that aspect of my job particularly. Well, I think there's several very important factors, and one could be the location of the primary care physician. It needs to be convenient so that will encourage frequent visits as appropriate to see the doctor. Also, if you're not feeling well, traveling a long distance is particularly difficult. Another factor could be personality compatibility. That's really one of the most important things. But I've really become convinced that the staff support is one of the most critical factors. And these are things you'll discover on your first visit and on your subsequent follow-up visits, whether the staff is particularly helpful, whether on the telephone or in person. That's very critical. Yes, that really depends on the chronic disease states that are being followed, and in a particularly completely well person, I think once a year is appropriate after age 40. But with certain chronic disease states such as diabetes and hypertension, which is what internists and family practitioners do day in and day out, dealing with those chronic conditions, it's appropriate to see the doctor 2 to 4 times a year or more often if necessary.
So get a primary care physician and don't make them a stranger.
Right. Get to know your doctor, and just that relationship helps in just getting the optimum outcome, I think.
Now, if you don't have a primary care physician, Norton Healthcare can help you out. Call 629-1234 for a referral. For Get Healthy, I'm Jackie Hayes.